Hi, everyone. Welcome. I'm Matt Murphy, Tour Program Supervisor at Eastern State Penitentiary Historic Site. Thanks for joining me on this brief virtual tour of the hospital block. And we're going to have a brief discussion on prison healthcare. So each Wednesday at 2:30, we will examine a different issue in the world of prison healthcare by looking at the past. Eastern State Penitentiary's rich medical history provides us with incredible stories and some really powerful lessons to consider. As we go along, feel free to ask questions or make comments in the comments section and talk to each other. And I'll try to get to as many questions as I can at the end. Today, we are going to discuss epidemics in prison. I'm going to tell you about Eastern State's battle with the disease tuberculosis, and we'll also discuss the current battle raging against coronavirus inside of prisons right now. Disease prevention was part of Eastern State from the beginning. It opened in 1829, a mile and a half outside of the city of Philadelphia on a plot of land known as Cherry Hill. Now, this was a place thought to be healthful, full of fresh air, and far from the plagues of an urban environment. The architect, John Havlin, designed each cell at Eastern State to have running water and flush toilets and indoor heating to create a sanitary environment for prolonged imprisonment. In reality, the prison proved to be pretty dark, dank, and diseases thrived. There were periodic outbreaks of smallpox, influenza, typhoid, and typhus. But none of these diseases rivaled the damage done by tuberculosis. It forced the prison to transform cell block 3, which is pictured here, into a very well-equipped hospital facility. Here we see patients and prison staff in the recovery room. Tuberculosis, also known as consumption in the 19th century, was by far the #1 cause of death in Eastern State's 142-year history, killing at least 600 prisoners. Here we see just a few of the people that succumbed to the disease at Eastern State. Like coronavirus, the disease often attacks the lungs. It's highly communicable, spreads when infected people cough or sneeze into the air. It thrives in crowded, unsanitary conditions like prisons. Tuberculosis can be a very long-term illness that takes months or even years to cure. Before antibiotics, doctors couldn't cure tuberculosis, but they knew that sunlight and fresh air could help slow the spread. So most treatment regimens at Eastern State involved quarantining sick prisoners in special solarium cells or sunroom cells, which we have pictured here. This is a solarium cell today in abandonment at Eastern State. Now the half-moon window above the door would let in lots of fresh air and sunlight. There's a wooden door that could be open a piece at a time, allowing the patient inside to control airflow. Additional facilities were constructed in the 20th century to manage the epidemic. This is the emergency hospital built in 1908. It was also known as the Consumptives Hospital or the Contagious Diseases Hospital. Here we see the Tuberculosis Yard. This was an exercise area just for prisoners with tuberculosis. Exercise and high-fat diets were thought to help sustain a patient's strength, extreme weight loss being one of the most notable signs of the disease. This is the construction of another solarium in 1922 above cell block 3. So the fresh air cure, as it was known, was used well into the 20th century. An X-ray room was added in 1917. New prisoners and staff were screened for the disease upon arrival. Here we see a staff member being X-rayed. Chest X-rays are a very common early detection tool for TB. Infection rates started to decrease in the 1920s and 30s as modern sanitation and hygiene procedures were implemented, and infection rates lowered in the outside world, so there's less people coming in with it. Antibiotics like streptomycin started to emerge in the late 40s and became available at Eastern State in the 50s. And this helped Eastern State further keep a lid on TB. Now, TB is still a major threat in prisons, with about 5% of all TB cases in America happening inside of prisons. Today, federal, state, and local governments are scrambling to prevent serious coronavirus outbreaks inside of prisons. With over 2 million Americans incarcerated at any given time, the potential for a deadly outbreak is a grave threat. Public health officials worry that the unsanitary and crowded conditions of prisons, where social distancing is impossible, are a haven, a petri dish for the virus. This puts corrections staff, prisoners, and their families at risk, and the communities that they're released back into. This graph from the Prison Policy Initiative shows us the rate of infection at Rikers Island Jail in New York City, which is the global epicenter of the outbreak. The yellow parts of the graph are the rate of infection per 1,000 in New York State. The red portion is New York City's rate, and the blue parts are the rate of infection at Rikers, which we can see are much, much higher. And the situation is evolving daily. Facilities are going into lockdown to restrict movements as much as possible. Visitors are being barred. Prisons are distributing extra protective equipment like masks and hand sanitizer and ramping up testing. Large-scale prisoner releases are happening all over the world. Thousands have already been released in the US. Most of those eligible for release are elderly, have an underlying health condition, are nearing the end of a sentence, and have non-violent, non-sex related convictions. However, public health experts are raising the alarm. Many in the field believe that these releases are too small, are happening too slow, and are too late to prevent a disaster. In Britain, on Saturday, it was announced that 4,000 prisoners were going to be released to halt the spread of the coronavirus in prison. In France, 5,000 prisoners have been released. In Iran, 80,000 prisoners. And keep in mind, these numbers have likely changed a lot already. These rapid policy changes and mass releases have raised a lot of questions about our prison system. If prisoners can be released because of public health emergency, do they really need to be incarcerated in the first place? What does it say about prisons as institutions that the people inside are at a vastly greater risk of catching a deadly disease like tuberculosis or coronavirus? What is considered a legitimate reason for early release? Will this change the way we think about things like sentencing and parole? Will compassionate release become more common? I'd love to hear folks' thoughts. Feel free to put them in the comments section. And I'd just love to open it up for discussion for a couple minutes. Let's see if we get any questions. Well, while we're waiting for questions, I was wondering if anyone had any thoughts. Are there any lessons we could learn or prison officials could learn from Eastern states' battle with tuberculosis? How does it relate to the coronavirus? Okay, not getting a lot of questions. Give it another minute or two. Does anyone have any questions about the history of tuberculosis or the hospital history at all? Okay, well, I encourage everyone to post their questions, and I think that'll be it for today. Thanks so much for joining. Remember that this hospital tour will happen every Wednesday at 2:30, and we'll have a different subject matter each time. In the meantime, we'd love to hear from you. Stay connected with Eastern State. There are many ways: Facebook, Twitter, Instagram. You can also go to our website at easternstate.org. All right, thanks so much, everybody. Have a good day and stay safe.